watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, government vaccine expert panel member, Dr. Rontgene Solante. Dr. Solante, welcome also to The Source. Maraming salamat po sa inyong oras. I will start already. I trust that you are happy with the announcement. I spoke to Secretary Galvez yesterday and he said booster shots may be administered. The target date is November 15.
Yes, good morning, Pinky. Yeah, we're happy about that. And hopefully it will now be given, especially to the healthcare workers.
Yun na nga po ang priority, healthcare workers, and of course also the immunocompromised, and I believe senior citizens as well. Dr. Solante, I know that you being part of the panel, you already recommended this, so eventually, of course, pumunta sa all experts panel, and then the HTAC also had a recommendation. Among health workers, can you please tell us, is there do you wish that your booster shots, that you will be able to choose which particular booster shot as recommended by the list coming from the WHO or the DOH? Gusto niyo ho ba makapagpili kayo?
Well, at this point in time, I think the issue of preference, yes, as much as possible, no. But we really can't also emphasize the issue of preference, because the data tells us that all of these vaccines can be boosted with any, whether it's a homologous or whether it is heterologous, so meaning a different platform from the primary vaccine series. All of these can be boosted. The data tells us that all of these are based on immunogenicity. Okay, so which means they measured the neutralizing antibody, whether it's Sinovac, whether it's Pfizer or Moderna, whether it's Astra, for those who are fully vaccinated with Sinovac, that's all right. Okay? So which means we still can attain a good protection as long as this booster dose would be given to the healthcare workers.
So you're clearly okay with any vaccine that will be recommended by the experts. Okay na po kahit ano. Let's talk about very quickly breakthrough infections, those who have been vaccinated and eventually caught COVID. Has this number increased? Do you have any numbers to tell us kung gaano po karami or nagiging prevalent po ba yung breakthrough infections?
I don't have data based on national data, but I do have data from the hospitals where I am working, like in San Lazaro Hospital and in some private hospitals. And it's really quite a lot during the time when we had the surge, beginning last week of July and then August and September. And that's one of the main reasons why some of these hospitals cannot fully function, because of we need to isolate the healthcare workers for 14 days. And in fact, there are also healthcare workers who really had severe and critical COVID during those times.
So it's really, with something like that, Dr. Solante, it's almost vital that you guys get your booster shots as soon as possible.
Yes, definitely, because it's not only here in the Philippines that we experience these breakthrough infections among healthcare workers. If you look at other Southeast Asian countries, Malaysia, Indonesia,
Thailand,
Singapore, and the other one, Malaysia, Indonesia. So those
Thailand,
are the countries that really are also experience a lot of these breakthrough infections among their healthcare workers. And in fact, these countries were already giving third dose or what we call the booster for the healthcare workers. They prioritize the healthcare workers starting last July and August, no? On that note.
Okay, so while we await that, sir, dahil hinihintay pa po yung EUA from the FDA and of course the recommendation also from the WHO, just want to shift very quickly with the hospital situations right now and this talk on possible downgrading the alert level here in Metro Manila. Do you think with what you're seeing in the hospitals that you are in, are we okay to shift to possibly alert level 2 soon?
Well, yes, I think I go for the downgrading of the alert level. most of the hospitals now are more or less the number of cases is really manageable. We're not having a lot of these new admissions of COVID on a day-to-day basis. And Pinky, it's a significant low number of cases that we have now in most of these hospitals. So if in the event that the alert level will be downgraded, then we'll just have to be ready again if there will be new cases and more of these cases will be coming to the hospitals. Yes.
Also, very quickly, wanted to get your thoughts on this because there's a lot of reaction, sir, dito po sa plano ng DOTR, the Transportation Department, to increase the capacity in public utility vehicles from 50% gawin pong 100%. Meron po kasi ako nakitang report that the man on the street, they were reacting to this at medyo natatakot pa sila. In fact, some of them naghahanap daw ng mga PUV na hindi masyadong puno. Do you think it's time or is it okay or nakakatakot pa rin ho ba? Siguro ganun na lang na gawin ng transportation at 100% kasi po tabi-tabi na po yung mga tao.
Sa akin lang, kung gagawin nila to, just make sure that most of these are vaccinated. Otherwise, kawawa yung mga walang bakuna dito, no? And there is still community transmission. Sino ba ang magsasuffer dito? Less likely are the vaccinated, but most likely are the unvaccinated. So, if in case they will make this a 100%, just make sure that they are all fully vaccinated and they really have to still observe the health protocol, more important.
I think it's also important you said, sir, fully vaccinated because in Metro Manila, we're over 90% a first dose and over 80% of fully vaccinated. Thank you so much for your time, Dr. Rontgene Solante.
Thank you, Pinky.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.